I was very delusional. I really couldn't participate in anything.
As a community, we need to come together and determine what is acceptable.
There are more times than not where I'm like, are you kidding me? They didn't do more? This person clearly is suffering.
It's August 2020. A man diagnosed with bipolar disorder leaves his house in St. Paul, Oregon. He starts a 30-mile walk to Portland, saying he's on a mission to resolve protests in the city. Earlier, he covered himself in bleach and household chemicals, saying the government was exposing him to radiation, according to his brother. This man's erratic and delusional behaviors are laid out in an Oregon Court of Appeals case. His story gives us a glimpse at the process when the state tries to force someone into mental health treatment, what's known as civil commitment. It also shows that with civil commitment, the bar is very high. In this case, a lower circuit court judge argued this man's mental illness was dangerous to his own health. But appellate court judges disagreed. They overturned his commitment, saying he didn't meet Oregon standards. Those judges said the man didn't drink the bleach, and his attempted walk to Portland, while inherently risky, didn't result in physical harm. Cases like that one show the complexities of ordering mental health care for someone who doesn't want it. But the reality is, very few mental health holds even reach a judge. KGW filed public records requests for civil commitment data in Multnomah County. When evaluating a patient on a temporary mental health hold, a doctor may file a Notice of Mental Illness, or NMI, which indicates they think a patient is a threat to themselves or others, so they should be held involuntarily. Our review found the number of NMIs filed by doctors in Multnomah County decreased significantly over recent years, from about 5,000 in 2013 down to 2,600 in 2021. Even more, most of those who received NMIs were released from forced care before a court hearing. They either agreed to recommended voluntary treatment, or county behavioral health workers reviewed the doctor's decision and determined the patient didn't warrant forced treatment. Kathy Shoemate works with Multnomah County's behavioral health team. She says they're often forced to make tough choices.
The doctor's like, oh my gosh, don't you see how symptomatic they are? How can you let them go? It's like, I understand, I agree, and the law says we're not at a point where we can force this to happen.
Sometimes mental health conditions can stabilize with medication, housing, and care, decreasing the perceived danger to the patient or the community.
Can we divert this person from civil commitment? Or do we not have the probable cause to take this forward to court?
About 12% of people who received an NMI in Multnomah County in the last 8 years received a court hearing. About 7% ended up with a civil commitment ruling from a judge. When someone experiencing a mental health crisis starts the process towards civil commitment, their first interaction is often with either a behavioral health worker or a police officer. Those are the people who first recognize the issues and bring someone to a hospital for evaluation.
Wanting to try and do what's best for the community, what's best for the person that is suffering or in the mental health crisis.
Lieutenant Chris Burley works with the Portland Police Bureau's Behavioral Health Unit. When a person commits a crime while showing signs of a mental health crisis, Burley says officers are trained to weigh whether a mental health hold and a hospital trip would be more productive than incarceration. But this can be frustrating. Officers don't know when someone is released from the hospital because of medical privacy laws. Sometimes they find the same person experiencing another crisis just days or weeks after they drop them off for evaluation.
The officer's trying to determine, okay, I tried, one avenue, that didn't work. I believe the person has mental illness. Now, what am I supposed to do if I know that, if I believe if I'm going to take the person to the hospital, they might be released right away.
That can create this cycle.
Yes, yeah. It feels like, we're not treating all of our community members the way that with the dignity and respect that they deserve.
Between May 2020 and April 2022, the Portland Police Bureau issued 3,057 temporary mental health holds, about 4 every day. In at least 13% of cases, the patient had been the subject of a hold in the past, meaning officers had judged them to be dangerous to themselves or the community, They were brought to the hospital, released, and then placed on a hold again. This number is also likely an undercount, as PPB couldn't identify more than 600 people who didn't have ID or give their name during the mental health hold. Other agencies and workers can issue holds too, and that's not reflected in police data. Cascadia Health and its Project Respond team initiated 524 holds in 2021. About 2/3 of these holds were duplicates, involving someone who was placed on more than one hold by behavioral health workers last year. It can also be hard for responders to differentiate from severe mental illness symptoms and drug use symptoms. Even if someone is diagnosed with a mental illness, doctors aren't allowed to compel treatment if they believe the person's threatening behavior was caused by drugs or alcohol.
If they have any type of substance on board, they oftentimes get released. And we need to recognize that we can't separate the two. How can we provide them the wraparound services so that they don't get to that crisis point?
Crisis points that are described in detail through civil commitment appeals cases. In July 2021, judges upheld a commitment for a man, initials DA, who had stalked a fitness instructor at a Clackamas County gym. He had been civilly committed twice before, in 2015 and 2017, for stalking other people. This time, a county investigator was about to release DA from his hold, but just before his release, DA assaulted 3 other patients at Cedar Hills Hospital, saying they were trash and he needed to take out the trash. In another case, appellate judges reversed a civil commitment ruling for a woman who threatened to kill her neighbors, nonprofit staffers, and animal service workers over delusions about her cats, saying they couldn't prove actual future violence is highly likely.
And that becomes case law. It continues to raise that bar when commitments get overturned and the appellate court says that's not enough.
But judges affirmed a commitment when a man threatened people in his apartment complex with a large kitchen knife and acted physically aggressive towards hospital staff. It was this case and the current legal standard that prompted Judge Stephen Powers to comment on the civil commitment process, acknowledging issues with our current system and how this cycle may not help people with severe mental illness. Powers wrote, "Maintaining a high bar for civil commitments may have the unintended consequence of failing to address mental illness before similar conduct leads to criminal charges and consequently the person's entry into the criminal justice system."